Dear guests, please take a seat. We would like to start with our event. Thank you.
Ladies and gentlemen, a very warm welcome from my side. There are some more seats up here in front, so don't be shy. Wonderful that you all made it. The rain subsided, so it was a little easier to get here, but we are still very grateful. Yes, please do come and have a seat. My name is Constanze Riedle, and I have the absolute pleasure to accompany all of you and online today through the evening. But I will not give the first welcome because it's certainly not my role, but rather Professor Johannes Vogel, who would have really liked to have been here, the host, the Director General of the Museum für Naturkunde, Berlin. But unfortunately, he's traveling. He's doing important business to keep the good work he's doing alive, and he'll tell us a little bit about it. So I'm not sure exactly where he is. He's somewhere in between. You'll see it's a bit shaky. It's kind of a documenta-style Danish film, but it's really from the heart, and we're very happy to show you his words of welcome and his sharing ideas, how he sees the museum work really fit into this work of One Health. So please, can we have the film with Professor Vogel?
Dear Minister Özdemir, dear honorable guests, dear colleagues and friends, I would like to welcome you very cordially to this historic event at the Museum für Naturkunde. My name is Johannes Vogel. I have the great honor of being the Director General of the Museum für Naturkunde, Leibniz Institute for Evolutionary and Biodiversity Research, but unfortunately, I'm currently at a summit of global research museums discussing our role for the future here in Munich. So I'm talking to you from this conference, and unfortunately, despite all progress in biomedical science, no clones of myself aren't available yet. So, since the inception of the early 2000s, One Health, the approach around One Health has come a long way. And I think the world is better for it. We need to break down the silos across sectors and disciplines to focus on common goals. And that has to be a healthy, sustainable future for all humans on this one spaceship we inhabit called Earth. I think the corona pandemic has shown us very vividly how we are interconnected with all other living beings on this planet, and what happens to us and our economies if we neglect the natural world at our peril. We cannot afford this any longer, and so we are so proud to be hosting at the World Health Summit WHO, FAO, WOAH, all of you, to discuss what should be the next steps to form new and important alliances for our planet and for humans on it, on the theme of One Health. We are really pleased that you are with us. I think also that we might not be a bad place to advocate for One Health. Our exhibitions already speak to the fragile and ever-changing nature of our planet. The dinosaurs around you once ruled the world, and you know, all you can see of them these days is a few birds tweeting in the skies. That's a fate we as humans may really want to avoid. So let's work together, use places like research museums of the Leibniz Association, which reaches hundreds thousands and millions of people, that provide as research institutes science-based evidence and tries to communicate this evidence in dialogue with society and policy. We are so happy that we can be your host tonight, and we are really looking forward being part of this discussion, working together for one planet, one health. Thank you very much, and I wish you a wonderful evening.
Thank you, Professor Vogel. That was a lovely and heartfelt, warm welcome to us. Now, let me hand over in a moment to Svenja Schulze, Federal Minister for the German Federal Ministry for Economic Cooperation and Development. But before you come up, I would just like to add one comment, because most of you probably in the room know this, but I think I couldn't really think of anybody more apt to be here today, because one reason, now you have this portfolio for economic cooperation and development, but beforehand you were responsible for the Ministry for Environment. And that of course included climate, biodiversity, nature conservation, and several other things. And as we know, with the inclusion of UNEP in the Quadripartite, that was a quantum leap in the whole sense of One Health. So I think you're one of the best spokesperson to really give us a welcome into that era. And with that, let me welcome you to the floor, please.
Thank you very much, Minister Jalla, Mrs. Manus, Professor Mettenleitner, representatives of the Quadripartite and One Health high-level expert level, ladies and gentlemen. We can only wonder and awe and try to imagine what our world looks like 150 million years ago, as we admire the dinosaur skeletons surrounding us, or the biodiversity wall. I really love that in the wall, on the wall in the next room. The wall of biodiversity here displays more than 3,000 animal species, and it is a vivid illustration of the wonderful diversity of life forms that our planet has produced. And at the same time, we are reminded that the diversity is fragile and constantly changing, and how close humans, animals, plants, and ecosystems are interconnected. It is no secret that our biodiversity is under threat. Every 4 seconds, an area of forest the size of a football field is lost to logging. Every day, up to 150 plants and animal species disappear from the earth. But we need these ecosystems for food security and for our health, for safe drinking water, fertile soils, clean air to breathe, protection of the global climate, and for our livelihoods overall. Saving and protecting the diversity will require the combined expertise of different disciplines. So, ladies and gentlemen, and that is exactly where One Health comes in. We live in a world where everything is connected, a world where a butterfly flapping its wings in Brazil can metaphorically cause a hurricane in Texas. The One Health approach wants to achieve a balance between the health of humans, animals, and the environment in this globalized world and work to improve it. The approach helps, for instance, to prevent global health threats such as pandemics or to respond effectively to such threats. This approach is also highly relevant for food and water safety and for controlling diseases that can spread between animals and humans. One Health can also foster new ideas when it comes to environmental management and the fight against antimicrobial resistance. New ideas that address the root causes of problems and provide long-term and sustainable solutions. In order to develop and implement effective measures, it is vital that administrative staff, researchers, and all employees work hand in hand in the local, national, and on global levels. This collaboration will be cross-sectoral and also cover areas such as public health, veterinary medicine, and the environment. And that is why cross-disciplinary collaboration is the guiding principle of the Quadripartite, an alliance of the World Health Organization, the World Organization for Animal Health, the Food and Agriculture Organization of the United Nations, and the United Nations Environment Programme. Whilst the first three organizations, FAO, WHO, and WOAH, has already been working together since 2010, UNEP is new on board, joining the successful trio to create the new Quadripartite. I'm just imagining how was the next step. With its name was 5. Okay, the aim of this collaboration initiative is to foster a holistic view on the topic of health. And we see this is a promising approach that can help to combine the protection of human and animal health and the protection of natural resources. In order to reach its comprehensive goals, the Quadripartite has developed a joint pioneering action plan whose launch we are celebrating today, and you see it here. It is really impressive. You know that there's a lot of work. So this action plan requires cross-disciplinary thinking and preventive action in order to strengthen the health system, preventing antimicrobial resistance and ensure global food safety. It is very important to me that this plan is very, very concrete, and in fact it is already very specific by defining clear action fields and goals. For instance, the action plan aims to reduce the risk of zoonosis, diseases that are transferred from animals to humans. By raising awareness, restricting contact with wild animals, and setting up an early warning system, we can prevent outbreaks more effectively and respond more quickly when they happen. The German Development Ministry is actively lobbying for the One Health approach to be mainstreamed in global policies and practices. The One Health Advisory Council of my ministry is advising and supporting us in our efforts. And our financial commitments also underline how important the Quadripartite's work is for the German government. We are contributing almost 4 million euro to support the sustainable implementation of the action plan in our partner countries. For instance, by funding the secondment of colleagues to UNEP, WHO, and WOAH, specifically for this task. As the German Development Ministry, we will continue to actively shape the Quadripartite's work in the years to come with dedication and political will, with the expertise of our staff, and with financial resources, because we all know that prevention is better than having to deal with problems that we could have avoided in the first place. The higher the pressure caused by man-made global threats and crises, the more important it will be for our experts and scientists, political decision makers and committed members of civil society to work together closely. My wish for the Quadripartite is that the action plan will prove an effective and sustainable working tool that brings together the different priorities, structures, and financial resources of the four partners in practical implementation processes. So, ladies and gentlemen, I would like to thank all the stakeholders who are working on the One Health concept and develop it further. I would like to personally thank you, Professor Vogel, and you, Dr. Grützmacher, for giving us this opportunity to celebrate the launch of the Joint Health Action Plan as part of the 2020 World Health Summit here at this special venue. I wish you all an inspiring discussion, and thank you very much for your attention.
Thank you very much. Thank you very much, Minister Schulze. That was quite a warm and good insight and good start into the discussion today. And without further ado, I would like to invite Madame Wilhelmina Jalal, Minister of Health from the Republic of Liberia, to my side to give us her side of the story and her perspective on today and on the quadripartite. Please.
Madam Minister, representatives and members of the Quadripartite, representatives of BMZ, GIZ present, distinguished guests, ladies and gentlemen. I'm excited to have been allowed to present tonight's address. Sincere gratitude and appreciation to all those different organizations that have come together to make this day a success, to make One Health a topic at this World Health Summit. I'm also grateful to the director of the museum for allowing us to be in such a beautiful place at such a beautiful time, at such a historical time in all of our lives. I hope that this collaboration will bear and yield fruits. I'm positive that as we leave these doors, a lot of changes will happen. This evening's panel on One Health, Joint Plan of Action, shows our commitment to collectively jump ahead of and minimize the impact of future health challenges on humans, animals, and environmental levels. Our realization that health of a human affects the health of an animal and the environment and vice versa has led us to want to make the requisite investment to ensure that the well-being of humans and animals alike is attended to. The interconnectivity cannot and must not be overlooked or minimized. In this globalized world, investment in this interdisciplinary response to emerging infectious diseases that originates from animals will significantly reduce the impact of zoonotic diseases and prepare for future pandemics. How can we utilize the One Health platform to tackle everyday health challenges? Critical among the multi-strategies to be employed is actualizing and implementing the platform beyond concept and into action. Collaborative, multi-stakeholder, multi-sectorial, and cross-disciplinary coordination and collaboration are required to achieve the greatest health outcome for everyone. In June of 2017, the Vice President of the Republic of Liberia officially launched the country's One Health Coordination Platform to productively facilitate the cross-sector collaboration to address public health issues that cannot be solved by a single sector alone. In Liberia, it is recognized that investment in One Health will promote efficient alignments of limited human, financial, and material resources. Importantly, a One Health platform will provide a mechanism for building systems that enable early detection of emerging threats to humans, animals, and environmental health, for mobilizing and deploying the intervention to mitigate the potential emerging and subsequent spread. Liberia understands that interconnectivity of humans, animals, and environmental health is highly important to combat emerging diseases of any future pandemic. We have seen the effect of the epidemic and pandemic and how they destroy our fragile systems. The overarching objective of One Health Coordination Platform is to collaborate and facilitate discussions on issues concerning the health of humans, animals, and the environment that cut across multiple sectors in order to, one, strengthen the institutionalization of a functioning One Health approach in Liberia to address public health events, including zoonotic diseases. Develop joint planning decisions and guidance for policies on prevention, detection, response, recovery that harmonize efforts across our sectors. Create a cross-sectional linkage to share data, information, resources, and capacity building experience. And leverage the core capabilities of each agency to determine and direct interventions to address possible threats that relates to human, animals, and the environment that cuts across all of our sectors. As one review joint action plans, the uniformity of our thoughts and commitment is glaring, as evidenced by 6 action tracks outlined in that plan. We must now include the political will to use the plan as a driver to implement our vision for One Health and advance our efforts in realizing our gains. Liberia commitment to One Health is evident. It sits under our Vice President of the Republic of Liberia. We believe that this shows a high level of political will and commitment, and it is hosted by the National Public Health Institute of Liberia, from where the Secretariat functions. Our government remains committed to the global fights against diseases of any kind, both zoonotic and other diseases of epidemic potential. We are most excited that the entire world has realized that disease is but a flight away, and it knows no boundaries. It has no respect for personality, income, and continent. This fight should be global. Thus the tagline, leave no one behind. The Quadripartite new One Health Joint Plan of Action is comprehensive and aligned well with our direction. Its 6 action tracks are broad and cover OH capacity, development and health system strengthening, reducing the risk of emerging zoonotic diseases, neglected diseases, AMR, food safety, and environment. As such, it will provide guidance to countries on key actions needed under each of them. Countries then can prioritize these activities based on country context and need. As we depart this World Health Summit and this gathering tonight, There are a few things I believe we must take back home with us. One, make conscious efforts to invest in health for all. Strengthen our One Health platform and multi-sectorial coordination mechanism. Push for strong political will to address the enormous health challenges each of our country faces. Renewed commitment from UN agency, intergovernmental organizations, donor organizations, bilateral and multilateral partners to support this great OH initiative. Ensure that the investment in OH are sustained and strengthened. Remember that most African countries are still unable to sustain many gains that have been made over the period. Finally, we should move towards integrating all of our activities to reflect human health, animal health, and protect our environment. Danke schön.
Thank you so much, Your Excellency. And you just shared earlier that you would have left tonight if it hadn't been for this invitation. So our gratitude is even larger that you stayed after, I'm sure, 3 intense days at the World Health Summit. So thank you very much. And the points that you made, we will take up later in the discussion, because I think they go through everybody's minds when we think about the One Health Joint Plan of Action being here and moving forward towards implementation. Now, one third person decided he would really like to send us off into this discussion. Unfortunately, he couldn't be here with us directly and in person, but he will say a few words pre-recordedly, and I'll make it easy for myself and just call him Dr. Tedros and not try to pronounce his full name. But I think we all know that he's Director General for the World Health Organization, and he was one of the hosts just now at the World Health Summit. So please, can we have his thoughts and words of welcome?
Dear colleagues and friends, today, the Food and Agriculture Organization of the United Nations, the UN Environment Programme, the World Health Organization, and the World Organization for Animal Health are proud to launch the One Health Joint Plan of Action to integrate and coordinate our work across the human, animal, agricultural, and environmental sectors. This new plan focuses on supporting and expanding national capacities in 6 areas: health systems, zoonotic diseases, vector-borne diseases, food safety, antimicrobial resistance, and the environment. We have one planet and one health, and together are working for a safer, healthier, fairer world for all. I thank you.
So thank you very much from that side as well. And I know, Minister Schulze, you have to leave because you have another appointment and commitment. Thank you so much for making it possible. And be sure that we'll let you know what the outcome of the discussion is, so that you can work with that. Thank you for coming. So, dear friends, colleagues, ladies and gentlemen, and critical minds, I think the task is quite clear that we have at hand. And the One Health Joint Plan of Action by the Quadripartite has been mentioned a number of times. And the 2 ministers are certainly not wrong. Things must be done after it has been written down. So let's delve into that, which is a tall order. In our own work, we, as International Alliance Against Health Risks in Wildlife Trade, we see ourselves at the very heart of One Health, actively working against key drivers of both biodiversity loss and future pandemics. And we actually attempt to minimize the health risks from dealing and trading with wildlife commercially. And by identifying effective interventions, unique, innovative interventions, and convening perspectives and practical knowledge from diverse disciplines. So in setting up this international alliance, in fact, in the last year, we have really learned both how hard it is to forge truly cross-sectoral and interdisciplinarity, as you mentioned as well, is needed, both communication and cooperation. But at the same time, we also saw how crucial it is when it actually works. And when, for example, our 100-member organizations start sharing their evidence, thinking together and start collaborating. And all of you 4 quadripartite organizations are part of that alliance, so I'm grateful for that and for the collaboration that is yet to come to move from concepts towards impact. But let's look at the Quadripartite One Health Joint Plan of Action. I think we've mentioned it a number of times, and that's why all of you are here in the room and also online. I don't know how many there are online, but we had about 850 registrations, so let's see how many numbers will come up in the end. We heard that the Joint Plan of Action was finalized quite recently, and only yesterday was published on all of your websites. So I'm sure most of you did not have the chance to read the 85 pages, which is why I'm specifically happy that my 4 panelists from the quadripartite organizations agreed to give us a short introduction and presentation of the actual plan. So one by one, I'll ask you to come up in front. And while of course your function is important and the institution that you represent, it might be interesting for us listening to you what is really close to your heart from within the concept and the approach of One Health. So I'll ask you to give us share a short thought on what keeps you up at night when you think of One Health, be it positively because there's so much potential, or out of worry. That is for you to choose. So I'll start with Chadia, Dr. Chadia Wanus. I'll speak a minute so you can slowly maybe join us at that very end. Dr. Chadia Wanus is the One Health Global Coordinator and Senior Specialist for the World Organization for Animal Health, with that new abbreviation WOAH. Many of us know it as OIE, as it was founded. And you're supporting One Health initiatives, including on emerging and re-emerging and endemic zoonotic diseases, AMR, food safety, and integrating the environment into the One Health approach. So what keeps you up at night?
Thank you, Constanze. Thank you for inviting us to this wonderful place and for hosting the first launch of the Joint Plan of Action. We cannot be more grateful for this and for all the support that you are doing. So what keeps me awake, I think we are not doing enough. We have to do more. When I think of the planetary boundaries and the tipping points that we hear about, especially from Professor Johan Rockström, and we have crossed many of them. So the urgency of action, it's what keeps me awake and thinking that we don't have time to waste. And now we have to invest in prevention, and we have to reverse the loss, the biodiversity loss, and many of the drivers that brought us here to this situation where we have pandemics and climate change and all these disasters that's happening to us. So time is now for action and urgency. Thank you.
Okay, thanks for that thought. Next, I'd like to ask Francesco, there you are. Dr. Francesco, why don't you, let me think, I have the order in mind. So join Chadia, next to Chadia. Medical surgeon by training, if I'm correct. You are the director of the Department of Nutrition and Food Safety at the World Health Organization in Geneva. And I can say that you were very busy and very active during the World Health Summit, so it's really nice that you could make this tonight as well. So what keeps you up at night? Would you like to share?
Thank you very much, and wonderful to be here in this venue. So I actually share the concerns of Minister Schulze, because we are living in such a terrible, unprecedented food crisis with 828 million people who don't have enough to eat. And this number is actually increasing, probably additional 11 million due to the Ukraine war. And the population is increasing. So we need to feed the people. And we need to feed the people sustainably. We need to feed the people without increasing the land cleared, without reducing biodiversity, without encroaching on wildlife habitats, without abusing fresh water, without using antimicrobials to promote animals' growth and to prevent disease in intensive livestock farms, without eutrophication of waters because of the excessive use of nitrogen and phosphorus fertilizer, and still without sacrificing the quality and the safety of our diet. So if you don't think that's a challenging task, of course that keeps not just me but many people awake at night, particularly the ones who don't have enough to eat.
Right, thank you. And on a slightly lighter note, fresh water is the key. Could we have water for my panelists, please? They'll be here for an hour, so they might want a sip to drink. Maybe someone can organize that. That would be great. Next, I'd like to ask Dr. Keith Sumpton to my left here, Chief Veterinary Officer of the Food and Agriculture Organization of the United Nations, came from Rome just today. Also, you're the leader of FAO's Animal Health Program and Chief of the Joint Center for Zoonoses and Antimicrobial, now I'm stumbling over the same as Minister Schulze, Antimicrobial Resistance, AMR. I hope you have something nice to share with us, something potential that keeps you up at night, or what is your thought?
Thank you. Well, again, it's really fantastic to be here, and thank you for the welcome. Yes, I think what I worry about, and I think my colleagues worry about too, is that in these complex problems that we face, which cut across multiple sectors, that we will have the technical idea what we need to do, but we don't have the political, structural, regulatory change that enables those things to take place. And in the end, all the potential that there is to work together to solve things at the field level is neglected and lost, and it becomes just a neglected part of the health services. Divided because they have constituencies driving health from different sectors, and not resulting in the sort of change. And who will really suffer? The people who are suffering at the moment, and the animals who are suffering through a neglect of basic health services. So we talk about primary health, primary animal health, primary One Health services are what we need to be able to be there for people in the rural areas as well as urban. And my fear is that we will not make the big changes needed to achieve that.
Let's make a first step today towards that.
Thank you.
And the fourth panelist I'd like to invite to come up, right here. I think that's still, sorry, I'll just take that.
That'll be fine,
yeah.
That's all right.
So you allowed me to call you Wandi. So I'll say Wandi Asnake Kibret. You are Policy and Partnership Coordinator with the UN Environmental Program based in Geneva. And in that function, you are responsible for the development and implementation of a wide range of partnerships in the areas of environmental sustainability, health, education, public participation, and socioeconomic development with various partners, including governments and sister UN agencies. So a very warm welcome to you as well. what are your thoughts to start us off?
What keeps me awake? Before that, let me steal 1 minute. Minister Schultz left, but I really wanted to say something about her. She's been a great champion for environment. I wish I could say it straight in her eyes, but she's gone. And one of the things we've been debating is how do we engage young people into the sustainability debate? And they have coined recently in one of our environment assemblies, they say there cannot be nothing about us without us. So we cannot talk about young people when they are not even present. And she was one of the only ministers willing to speak to young people during the EU presidency. So please send that message to her. And also she has truly shown the political will, but also the political resources. Recently, Germany has put in a good amount of resources for Nature for Health, and that's the kind of appetizer that we need from other governments. Having said that, what keeps me awake? My two beautiful kids keep me awake. They are 12 and 14.
So they sleep through the night.
The apple of my eyes. I worry about their future because they ask serious questions about, Dad, this is the most highly educated generation of all time. We just flattering ourselves, but we specialize in pollution. We are polluting the planet. How is it possible that this level of education leads us to the kind of stuff that we are doing to the environment? So I worry about the future. That means about the triple planetary crisis, the climate change, biodiversity loss, and pollution and waste. That keeps me awake, and I hopefully will be able to invest more into not just talking about future generations, but actually investing in the future.
Thank you. Thank you, Wendy. Okay, I'll give you the floor. Talk us through this plan of action, this joint plan of action. I think you brought with you a presentation that we'll see in a moment. And I think it's vital for all of us to understand because there's so much thought has gone into it. And I'm sure you represent a whole team of thinkers and doers behind you. So please talk us through and explain to us what. You can see the slides there as well.
Thank you.
Go ahead.
Thank you very much. So with my colleagues here, we'll present an overview of the One Health Joint Plan of Action. And if I can have the first slide, please. The next slide.
Also, actually, I think you can do it here. Let's try.
Okay.
Perfect.
Okay. Thank you, everyone. This has been a real teamwork over the last year. Not much more than a year in total, about a year and a half of work. At the meeting of our Director Generals in February last year, it was decided that then, together with UNEP, we would work upon developing a strategy that became this action plan, the joint action plan, among the 4 organizations in order to prevent, predict, detect, and respond to future health threats under a One Health approach. We have worked together as drafting teams across the organizations, and including from our regional experts and our country teams as well. Last year, also, the One Health high-level expert panel was created, and that group has also played its important role in reviewing the development of this plan. And we're grateful to Thomas, Wanda, and the team, the OLEP panel, for their help in this, developing the theory of change, which will come in later, and in improving and ensuring that we have a joint understanding what we mean by One Health. The consultations with our members were also important, conducted by the Quadripartite organization, which allowed us to talk through many of the aspects to understand how it would be, what it was intending and what its implications would be. And the document, we hope, gives a clear vision, commitment, and a concrete work plan for One Health for the Quadripartite. The definition that the One Health high-level expert panel provided is One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at various levels of society to work together to foster well-being and tackle threats to health and ecosystems, addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. Some people worry that everything is in there, so where does the detail come? And that's where we will come to a bit later. Having this definition agreed between the 4 organizations and for the organizations was one of the great starting points for this work. While health, food, water, energy, and environment are all wider topics and have sector-specific and specialist concerns, collaboration across sectors and disciplines is vital to protect health, address those challenges, such as the emergence of infectious diseases and antimicrobial resistance. Moreover, One Health linking humans, animals, and the environment can help address a whole spectrum of disease control, from disease prevention through to response and management. This approach, we believe, and we have examples from our work, applies at community, subnational, national, regional, and at global level, and relies on governance mechanisms, communication, collaboration, and coordination. Many of those things are difficult and not necessarily in place at the moment. Measuring progress in those areas is important for us to see that that is taking place. Where does this fit with pandemic prevention and of the major health risks? Well, when it comes to prevention, it's essential that we reduce those risks of pandemics arising from the interface between humans, animals, plants, and the environment. Risks, we recognize, emerge from the altered ways in which humans interact with animals and the environment, and the increased contact with wildlife through habitat encroachment and trade, loss of functional ecosystems, and changes in our agri-food systems. The key drivers stem from the fabric of our society and are fueled by structural issues such as poverty and inequality, underinvestments in integrated health systems, population increase, and increased movement of humans and animals, locally, regionally, and globally. Only by working together with appropriate cross-sectoral investments can we understand how better to how these risks emerge, how they can be mitigated, and how countries can prepare to react swiftly when things go wrong. So there's an emphasis on prevention in our approach, but we recognize working together is essential at the response as well. And I pass to my colleague for the next. Thank you.
This is not the metro map. This is actually the whole structure, how we create impact. So in particular, we need to go through specific pathways of change in terms of the policy, legislation, advocacy, and finance, in terms of implementation and sectoral integration, but in terms of data, evidence, and knowledge. And then this path of change will be supported by a number of actions that would hopefully lead to a midterm and long-term outcomes, but to create one specific impact. What is that we want out of this map that you see here? A world better able to prevent, predict, detect, and respond to health threats and improve the health of humans, animals, plants, the environment, while contributing to sustainable development. That is the big game. That is the impact that we want to create. So how do we want to do that? So I'll speak about the 6 action tracks. So the first one is, how do we enhance One Health's capacity to strengthen health systems? This particularly involves strengthening One Health capacity through guidance, methodology, and tools, sometimes actually building on existing programs, effective implementation of multi-sectoral approach. That is something desperately needed. We need as many sectors as possible to work together. Preventing and managing risk at the human-animal plant environment interface. That is the first track. That's what it's supposed to do. The second track is talking about reducing risk from emerging and re-emerging zoonosis epidemic and pandemics. What does that mean? Understanding the drivers of emergency, spillover, and spread of zoonosis pathogen. Identify and prioritize targeted evidence-based interventions. Strengthening national, regional, and global One Health surveillance early warning systems. And the third one is controlling and eliminating endemic zoonosis, neglected tropical and vector-borne diseases. So what does that mean? How do we reduce the burden of endemic diseases? One is we need to enable countries, meaning supporting countries to implement community-centered solutions, ensuring policy and legal frameworks from local to global level and across sectors. That means harmonizing application of One Health principle at all levels, increasing political commitment and investment. This is very, very important. It's one thing to talk about it, but if we do not invest that political capital and resources, it is going to be a difficult task to advance. And the fourth track is talking about strengthening the assessment, management, and communication of food safety risk. That means strengthen One Health approach in national food control systems and food safety coordination, leveraging data, scientific evidence, and risk assessment for improving policy making and risk management decision making, and then integrate national foodborne disease surveillance system and research across One Health. Now, the track 5 is, I think we've been talking about it throughout the last 2 days in terms of AMR, the silent pandemic. The objective is take joint action to prevent antimicrobial efficacy and ensure sustainable, equitable access to antimicrobials for responsible and prudent use in human and animal and plant health. So what does that mean? Strengthen the capacity and knowledge of countries to prioritize collaboration on One Health work on to control AMR, reinforce global and regional initiatives, programs to influence and support One Health response on AMR, strengthen global AMR governance. And then the last one is on integrating the environmental dimension into One Health. We're like the neglected kids up to now. But we were not actually neglected. Everything that is talked about, whether AMR, food safety, zoonosis, it is just in the heart of the environment. So, but it's good that now officially it is part of it. So what is the objective is to protect and restore biodiversity, prevent the degradation of natural resources and the wider environment, to promote the health of people, animal, plants, ecosystem. Meaning we must mainstream the environment into the One Health approach. We must integrate environmental knowledge, data, evidence into One Health decision making, and then create an interoperable One Health academic and in-service training program for the environment, medical, agriculture, and veterinary sector professionals. And finally, I think this is still my slide here.
It is.
So what is our vision or the future of this joint plan of action? So the implementation plan, more specifically, how do we engage what is called the UN Sustainable Development Frameworks? We have 130 resident coordinators in 132 countries, working in 162 countries. So we have something called multi-country, so they combine so many of them. How do we use them? We have this kind of assets that are available out there in 162 countries. How can we make it a priority for that country, the integration of One Health? Monitoring and evaluation, the link to the SDGs. One Health is entirely linked to we can link it from SDG 1 all the way to SDG 17. It's very much interlinked, so let's use it. I mean, next year is the midterm. It's been now almost 8 years since we have adopted the SDGs. What a way to start by also embedding the One Health approach into the final run to the 2030 agenda. The budget, of course, as I said, not only friendly governments, everybody should contribute into that. So it's important that we have a great plan, but if it is not invested, or if we have not invested in it, it's going to remain a great plan. So let's make sure that, as I said, we can follow the lead of Germany, and we have so many who are interested in this One Health approach to invest in that. Communication material, that is absolutely, we need to communicate. It's interesting, not too many people still don't understand what this One Health is. Despite it's been out there for a while, so we need to invest more on.
Let's go through the presentation and have some discussion on those points later.
Absolutely.
Okay.
I'm done. So over to you.
Thank you. And my task is to tell you a little bit about what next. And you've heard the joint plan of action is giving us a good description of the scope of the work on One Health. And it also describes the different components of the work that particularly we as UN agencies, part of the Quadripartite, should be responsible for. But then, clearly we need to have a very concrete operational tool for countries to take their action. And so we thought that perhaps we need another iteration, which is somehow what we call the implementation framework. And the implementation framework is going to be much more practical. We still have to see how it's going to be structured, but we would like to learn from actually the countries who have already undertaken this task. And I was extremely pleased, and congratulations to Liberia for already having established a platform. Actually, we would like to learn from the example of Liberia. We also have, we know that in collaboration with GIZ Cameroon, for example, has also undertaken this task. So we would like to see how this can be translated into a framework which is general enough and adaptable, like a blueprint, really, that can be used, that responds to country needs. And that's the next important element, because the needs are different and the capacities are different. So we need to be able to indicate and tailor this to the needs of the countries. This is not starting from scratch. Countries are already active. They probably need to readjust, and I think, as the minister was saying, make the best use of the resources. The alignment is helping optimizing the resources that are there, with a stepwise approach to bring initiative up to scale. So I think it would be overambitious to try and do something at the same time. We need to see what is the core, and then see how it can be progressively expanded, but in a way that really reaches the scale that is needed to perform its task, which is really full protection from the pandemics. Evidence-based, of course, the identifying the clear responsibility for stakeholders. It's not just the government, but it's also civil society. It's also the private sector that will have to play a role in all of this. They don't have to pursue their own tasks, their own objectives. They need to adjust to the common, really public objectives. The role of the community. Yesterday we had a very interesting conversation and understanding really how communities need to be involved, because they're the ones who often have to practice the One Health measures, and then making sure that we are able to track and monitor the implementation of the plan. So we see that there are, I think one dimension, the pathways. We see the different components there, so there will be some, of course, policies to be adjusted, legislation to be established. This has to come with financing, as Wendy was saying, as adequate advocacy. This is not business as usual. So we need to somehow start from a review of the existing measure to see how the One Health plan is going to change the practices. It will contain a map and recommendation and suggestions on how there should be a development of certain organizations, and also basically what each sectors will have to do. I think that's really the heart of the matter. Each sector will have its own responsibility. Clearly, the health sector, the food sector, they are the environmental sector, primary responsibilities, but there's more than that. And finally, data, evidence, and knowledge. How do we connect them? And data are particularly important, because unless we have really well-designed surveillance systems that are interoperable, and then have data that communicate, we're not able to track the evolution of the whole system. Now, what are we going to do in this? How are we going to do this complex task? We want to be ambitious, so we already have an agreed concept note. We're brainstorming on how to design this implementation plan. Next step is actually to be listening, to be in a listening mode to all the work that countries have already been doing, to understand what their needs are, and then hopefully design a document that can be then reviewed by the Quadripartite as a whole, and then presented to our senior management in March. And then basically life starts, because the whole implementation will start in April. And Shadia is yours.
Thank you. Thank you so much. Next.
Can we have the next slide?
Let me try again.
Yeah.
I'll do this for you.
Okay, thank you. See,
True
collaboration in action. So, you heard now about the plan, how it came about, what kind of actions we have, and the pathways for change that we will use, and the next steps outlined by Francesco. So now, what's our offer to countries? We actually coming together as 4 organizations, each with our mandate, with our experience and expertise, and specific qualities that we can offer to countries to help them support the One Health implementation at country level and at subnational level as well. How we are going to do this? We will spearhead the support to establish or strengthen the multi-sectoral coordination mechanisms at country level. Like Dr. Jala, the Honorable Minister from Liberia, pointed out, this platform provides all the sectors the opportunity to develop their own plan, to talk about funding, about implementation, and about monitoring and evaluation. So we will be supporting this. We want also to identify the investment opportunity out there. We know that there are a lot of multilateral funds We have now the new World Bank Financial Intermediary Fund, the fifth. We have other also the Multi-Partner Trust Fund on AMR and other, the Nature for Health Fund. So we want to identify this opportunity for investment, and we want to support countries when there are call for interest to provide a proposal, to develop this proposal, and if they are successful, to support them to implement this in the field. We want also to be seen as the implementing core agency for all actions on One Health. And when there is these kind of funds to collaborate with us and to be the implementing agency of these funds. Next slide, please. Now, on terms of advocacy, how we are going to do this, and we are already starting this process. We are working with many political forums like the G7 currently under the German presidency, the G20 under the Indonesian presidency. We hosted One Health side events. We developed One Health policy briefs to countries to explain the approach and also to give the set of activities and action that countries can take. So we will leverage these existing platforms, but I want to talk a little bit about the financing again, because without the finance, we will not be able to implement anything. So the issue here is to use every available channel for us, from multilaterals, but also from domestic funding, to convince and incentivize the countries to invest more on the One Health approach in their countries. We want also to bring the private sector along with us, and we have many opportunities to leverage this partnership. It's very important, public-private partnership in our regard. They ask us, do you have an estimate to give us about this? And we have some indications. We have the World Bank, for example, and the WHO. They estimated that what's needed annually for health emergency preparedness is 30 billion. And the World Bank estimated recently that what's needed for prevention part is 10 billion per year under the One Health approach. But how much is needed for One Health? Not preparedness alone, not prevention alone, but One Health approach. We don't know yet. And how much should go to the animal health sector, to the vet services, to bring up these capacities to be able to implement the approach. This is the work that we are doing now through our study on return on investment, but also through our quadripartite task force on finance, coming up with these exact figures to help us use them in the advocacy, in the different political forum, to advocate for prevention, for the One Health approach. Next. So this is our promise to you. We are committed to continue to advocate for the One Health approach. We are stronger now with the UNEP joining our collaboration. And we are also reaching out to all partners out there, outside the quadripartite, outside the UN system, to bring all key stakeholders, civil society organization, academia, through our One Health high-level expert panel and other science policy interface that we have. So with this, I thank you, and I look forward to the discussion. Thank you.
Well, thank you very much. And don't worry if you couldn't read it from the very far. As I said, the Joint Plan of Action is at least on the WHO website. I saw it, and I'm sure on the others it is set up as well for download. We specifically did not bring many copies in paper because it's large and heavy, and obviously we didn't want to use any paper unnecessarily. So please download it and read it. But we have a chance now to look into it in more detail. And I'll open the floor in a minute to questions from you and also online. Maybe, Anja, you can have a look whether there is anything that you might want to share with us. Okay, but to do that, I'd like to ask Thomas to join us. So one more panelist on the panel. So Professor Thomas Mettenleiter is not only the director of the renowned German Friedrich Loeffler Institute, but also co-director of the OLEP, so the One Health high-level expert panel that really assists and advises the quadripartite, and that has been mentioned. And I know we've been in close contact, and I know you've been instrumental in the definition and in other thoughts for this joint plan of action. So I'll open the floor, but I have a first question for you in a minute, so keep on board. Is there what is burning under your nails, as we say in German, in the room? What would you really like to know, and definitely not leave the room without asking that question? We have a question there. And Chris, if you would like to introduce yourself briefly.
Yes. Oh, Chris Walzer, Wildlife Conservation Society. So I have a question on the governance concerning, you talked about that you would like to be the implementing agency, and it's unclear to me how you mean that. Is there any kind of governance structure on receiving funds and dispersing funds? Because you want to implement on the ground. How do you envision doing that? Thank you.
Thanks for that question. And we'll collate a couple. Yes, we have a question here in front, Sonja. While you come up, Isabel, why don't you ask the lady the one you just passed? No, on the other side? There you go. And then we'll take this question in the front.
Thank you so much. I'm Nicole DiPaolo, working for the UN Food Systems Coordination Hub. My question is if in this there is any space in the plan for the issue of gender equality, the role of women empowerment, and going beyond the technical aspects of the One Health. Thank you very much.
Thank you, Nicole. And then we have a question here, Isabel here.
Thank you very much. Feedback? No. Donald, Foundation Healthy Planet, Healthy People. Also a question regarding implementation, because I think that is very crucial. In my understanding, it's a lot about getting the measures implemented on the national onto the community level, to have organizations, people there doing it on the ground. And I was wondering, maybe you can tell from experience, since you're different organizations having to deal with different departmental structures, what would be your recommendations to governments, communities? How can they sort of bridge the gaps of different departments, different responsibilities? Yes, that would be lovely.
Thanks, Donald. Okay, let's leave it at that. Can you keep that hold that thought? I'll not forget, but I was going to see whether Anja has anything from online chat. I can't really see.
Yes, sure. We have a number of questions. So one, for instance, is what are the strategies and key areas of addressing to implement the One Health concept on the ground in the low and middle income countries?
Okay. Hold your voice.
I've got more.
Yeah, good. I'll get back to you. But those are 4 very interesting questions, so I'll throw them back to you. Any volunteers to take any? So we have the question of the overall governance, Chadia, that you mentioned, implementing agency. We have the question of gender empowerment, whether that is included, and if so, where and how. Question of implementation. So what is your recommendation to governments, how to bridge the sectors, how to cross the sectors? And then we have the question, what are your thoughts for on-the-ground implementation in low and middle income countries? Anybody?
I will start. Excellent. I will take the question on gender, because I am a gender advocate and champion. Thank you for the question. And actually, it's one of the key areas that we have to talk about on the One Health implementation through our framework. We have to mainstream gender in all our One Health operations. And we understand that this is gender inequality is one of the social determinants of health. So if we don't address it, we will miss a lot and we will not achieve the impact and the goals that we are set to do it. We know that during the pandemic, COVID-19, we had a lot of setback in terms of gender equity. Around it sent us back 36 years. And it's estimated that we will need around 136 years to reach parity on many of the different aspects of global health because of the pandemics. So we have the opportunity now to work together through this joint plan of action to integrate gender into in all our operations, starting from education, our training courses, but also advocating to have more women leadership. And we are very proud to have our minister here and the Minister of Environment from Germany. But when we go up the ladder, we know that this percentage, it's not correct. We have only 25% of women in leadership position in global health in general, while we have most of them in the health workforce. So why this imbalance between this? We have to correct it, and we have the opportunity to do it with this One Health Joint Plan of Action. Thank you.
So we'll look forward, once we have the implementation plan, Nicole and the other interested parties will look for the gender aspect specifically. Excellent. Keith, please.
Yeah, maybe I try to answer or address the first question, which was partly about governance, but also brought in the implementation aspect. I don't think we would want anyone to go away thinking that when we talk about financing, we're talking about financing for organizations to make the kind of global change and aspirations which are needed. I think what we've emphasized is that there are a lot of frameworks, there is significant funding and significant financing that countries are accessing for different purposes. What we're intending to do is to ensure that when those opportunities are taken, we're saying, are we actually doing the kind of changes, investing in them, that include the One Health approach? And in including the One Health approach, does it truly build a better, more collaborative, interdisciplinary system? Or is it an investment in only one of these 6 areas that doesn't truly benefit really the system strengthening? So what does that mean? It means that we do have complex governance because we've got 4 organizations, but we also have a mechanism for working together and to be accountable for the plans that we have. But the implementation of this is going to involve huge amounts of financing if it's going to be a change, and that will mean influencing those financing mechanisms which already exist or will come into play to ensure that they have a proper accountability to include the One Health approach in their mechanisms. So that's many of those have already been mentioned so far. Thank you.
Thank you. Thanks, Francesco.
Yeah, and I'd like to address the question that came online about what are the strategies in key areas. Well, I think, as I said, we need to be in a listening mode. So I don't think we can say that up front, but certainly there are some common elements that emerge as common needs. I mean, one of them is having surveillance systems which are efficient and which are supported by adequate capacity. Laboratory diagnostic capacity is a big problem for low and middle income countries, so we need to address that, for example. But we need to have a good capacity also of analyzing the risk, and then we need to have adequate human and animal health workers' capacity. So I think the surveillance and the capacity building are clearly 2 important areas. And then there's the specific sectoral needs. For example, in the food sector, we need to have adequate food control systems that will reduce the risk of unsafe food, but also the risk of zoonotic diseases. But in general, I think we're looking, and I'd like to ask maybe Thomas to comment on that. We're looking at also the OLEP to give us a good idea of the priority elements for good prevention. I think they're preparing a good prevention paper that will be of importance for the clear implementation of the plan of action.
You're asked directly. I would add another question if you don't mind, and then you can
go ahead.
Because
hopefully the question on the night's sleep. I mean,
no, I decided not to ask
you
that
come on.
because we've heard a lot about night's sleep. So maybe later.
I was looking forward to that.
Okay, hold that thought. I'll give you the chance. No, but I did want to bring you in on the data and evidence and knowledge, and I think it has been mentioned in all of you four inputs. That really that is the basis in a way also for implementation, because we've heard about the why, the joint plan of action, the who and the what, but not so much the how. So that maybe if we look into that, I'd like to ask you on that, and especially how do you think the different sectors could be fully integrated? This goes also to Donald's question in a way, how could they be integrated for a One Health approach, especially looking at the decision making?
Yeah, thanks very much. I mean, first of all, I think we have to define what OLAP actually is and does. So the One Health high-level expert model gives scientific advice to the partners. Started out as a tripartite plus UNEP, now it's the quadripartite, and I think this is also a milestone that we should keep in mind, that a year ago the quadripartite didn't even exist. So I think, I mean, this is something that really is a first step towards the 4 C's that we have in the OLAP definition of One Health, which is collaboration, coordination, communication, and capacity building. I mean, and the first step is indeed communication, to talk to each other. And I think, I mean, this is facilitated by the quadripartite. So I'm quite happy also. I mean, you showed the slide of the 4 partners, that it was actually launched as a birthday gift for me, because it was launched on March 17. My birthday is on March 18. So I appreciate it very much. Thank you. So the OLAP gives scientific advice, and I think, I mean, this is something that I would really like to stress. We are not any kind of executive body. We are not a funding agency. We are a collection, let's say that, of scientists, and I think, I mean, this gives a good basis and credibility, I mean, to the implementation of One Health towards doing it indeed on the ground. One comment on the joint plan of action. I mean, OLAP in its first term in our terms of reference is focused on zoonotic infections. And this is, of course, influenced by the COVID-19 pandemic. It's a bit sad that it took a pandemic to bring us together and to bring One Health to a public and political perception that it had never had before, I would say. But anyway, I mean, let's take the chance as long as it's there. And this scientific-based advice in all these different aspects that are covered by the 6 action tracks, and they are not just on pandemics and epidemics. They are also covering the other important topics in One Health that are part of the definition. I think, I mean, this is our main goal. Now, in terms of, I mean, what are we actually doing? I'm thinking the first major step was indeed the definition. And I have to confess that I didn't realize when we started that as something more internal for OLAP. What are we talking about within OLAP when we talk about One Health? That was the goal of this definition. And we ended up having something which is a little complex, but One Health is complex. And I can tell you, we actually discussed every single comma in this definition, back and forth, to come up with that. Now, it is a more inclusive definition. It's not an exclusive definition as the one before. But I think it's important to also say that One Health is an inclusive philosophy to start with. And this is reflected in this definition. So I'm also very happy to see that this definition is now being supported not only by the quadripartite. You see it in the final communique of the G7 health ministers, for example, that met in Berlin. Specific reference to this definition, and out of 39 paragraphs, 8 paragraphs mention One Health. I mean, we heard about the speech of our Federal Chancellor, I mean, who also talked about One Health. So I think we have a high visibility. Now, since you are not asking me the night's sleep question, I have to answer it myself. What really I mean, is a positive aspect is that we have this high visibility of One Health. It's even in a situation that we have to be very careful about using One Health, because whereas sometimes you have the label One Health, but if you look inside, it's not One Health. It might, for example, be just one medicine, the cooperation between human and veterinary medicine. But the important aspect is the environment. And this is also the positive aspect, that it doesn't really keep me awake at night. Fortunately, I have a good night's sleep. But it's something that I think is very positive and is an example where we really made a lot of progress. On the downside, it has already been mentioned, there are so many other topics and crises that developed recently that I'm a little afraid and worried that the window of opportunity that we have in really implementing One Health, and not just talking about it, implementing means money, implementing means all the political will to do, though, that this window of opportunity is already slowly closing. So there is some sort of urgency as well in this aspect. So we should really hurry up to get that done rather quickly. And OLEP is a facilitator in that aspect. So, I mean, in the joint plan of action of the Quadripartite, there is a significant part of OLEP expertise included as well. We are lobbying for One Health in these different areas, and we are currently working on a theory of change of OLEP, which will supplement and expand, but will be aligned with the theory of change of the joint plan of action. And we are also working on a paper on One Health surveillance. So, I mean, what does it actually mean to implement One Health surveillance issues? What do you have to take? What do you have to keep in mind? And this will come out within the next couple of weeks. They are essentially finished. We still, at least for the theory change, we need the green light of the partners. But I have to admit they received that by the end of last week. So you have just one more week to have a look and give the green light. The surveillance paper is basically finished as well. And the last one, and this is also important, and it has been alluded to here, that is the discussion on what actually drives the situation. So, I mean, this surveillance not only of pathogens, but also the surveillance of drivers, and establish which drivers are important. And this is also something that is science-based. And I mean, looking deeper into that, you realize that, I mean, we are saying, I mean, it's obvious, it's land use change, it's globalization, whatever. But if you look at the scientific level, what the hard data really tell you, it's sometimes not that clear. And this is also something that we are currently trying to complete and that get out. And the last point I would like to make is, this is dear to my heart also at night. I think we have to implant the concept of One Health, not only One Health in all policies, but One Health in all minds. And my feeling is One Health is actually not a concept. One Health is a way of living.
Thank you, Thomas. This is not the end. We have a couple of more minutes, although it would have been a nice last words. But I'll give the floor to you, Wendy, to answer some of the questions.
Quickly, it's not only the headquarter-based organizations who are working on the One Health approach, but also the regional offices. There is also a regional process in terms of how do we take it to the regions. For example, the Monte Commission did an excellent report in terms of how do we bring One Health to the forefront. When I made that brief presentation, I talked about UN country teams. Probably answers the question on developing countries. We have 162 UN country teams. If we could put it on the agenda of the UN country teams. I was very happy when you were moderating the session on food system transformation. You talked about we could actually put this agenda into the resident coordinators file. And this is something that we can actually do, not just explore, where they have access in terms of priority areas in that specific country. And One Health could actually be one of the priority areas that could be integrated into the country programming.
Thank you. Thanks for that concrete idea. That goes just in the right direction, because I'd like to really boil this down, what we've heard. And I'll start with you, Keith, asking you about monitoring. not so much evaluation, but really monitoring the metrics, so to speak. So if you do get to a point as Quadripartite and on the global, on the regional and the country level that something will be implemented, how will you monitor it? And what are your thoughts on that? I'm sure you've discussed it. How will the progress really towards expected concrete results of the joint plan of action will be monitored, and what can you share with us so far?
Yes, thank you. So I think can be a huge amount of emphasis on assessments that comes into the health and environment world, and sometimes our colleagues country level are really kind of tired of the number of assessments. So what we're not going to do is to invent a whole lot of things that need to be applied again to countries which are really looking for support to their proposals and their financing. So I think what we're thinking about in monitoring is firstly, are we doing what we said we would do in terms of working together? So you see us working together as we have over the last year and a half. Do we continue to do that faithfully in front of you and show you that we are going on from the plan into all those other steps that we've talked about? So that's one.
What's the metric for that?
What's the metric for that? Well, we do have mechanisms with our annual meetings that we report on that. We don't have a joint governance mechanism in that sense. We don't have any time. All our members, the 4 organizations, come together and ask, how are we doing? Some people have suggested that. But there'll be the things that we said we would do. And then there's the influence. Are we, in our theory of change, are we influencing that change? And are we seeing those change in terms of change in, let's say, the governance at country level? But also the one healthedness of those systems. So do we see that instead of having separate monitoring, we can also see that they're actually working together. They've set them up and they're working together. So we need to keep it easy. We don't want to have such a simple metric that would be based on one thing like how quickly do we detect a pathogen when we actually want a system to be delivering primary health care. So that's more the influence that we'd be looking at for that. Thank you.
Okay, thank you. Chadia.
Just to add to what Keith said, when we are now developing the implementation framework, it will be accompanied by monitoring and evaluation framework. And we are looking at this question of indicators and tools. We have so many tools that we developed individually or together. So we are mapping those tools for One Health, and we will see if they are adequate for the implementation of this plan, or we need further development of new tools or different way of assessing and supporting countries to implement the One Health.
Okay.
Thank you.
Thank you. Any more questions from the floor? Yes, I promised you'd have your say, so please. And if you could briefly introduce yourself.
Hello, Katrien Tersago from Belgium. I work for the Ministry of Health, Family Matters and, let's think again, Welfare in Flanders. And I have a question with regard to implementation. So even if the One Health aspect is not that big in the European countries, we do work on that aspect. And I wonder, with regard to the implementation, at this moment, some of these questions are addressed in the NEHAPs, we call it, the National Environmental Health Action Plans. And I wonder to what extent the One Health Action Plan is actually an add-on, or how would we, like, some of the questions are, might overlap, or certainly because those groups work on the interface between health and environment. So,
thanks for that question. We'll collate a couple. Right next to you, I think there was another question. And then I see you, sir. You'll get the next one.
Thank you very much. Sarah Collinson from Site Savers. Actually, I have a question that follows directly on from the previous one. In terms of implementation, will the implementation plan speak to other plans we already have out there, including the roadmap for neglected tropical diseases and making sure that this implementation plan speaks to that one and that they actually complement and support one another. I had a question also about accountability when it comes to governments. What would you want to see in the pandemic instrument that is being negotiated now, where One Health is emerging as a key issue and theme of those negotiations? Thank you.
Thank you very much, especially for the second question. I applaud that. One more question, or shall we take those two because they're closely linked? Chadir, I see your hand. Go ahead.
I will take the second question about the pandemic instrument. On 14th of October, we had the One Health consultation for member countries to discuss exactly this, how to put or position the One Health approach into the pandemic instrument, and what kind of concrete actions can go into the text of the instrument. And we had the opportunity to have many OLEP experts invited to the panel, and also WOAH and UNEP on behalf of the Quadripartite. The main issue that we discussed that we need the One Health definition to be there. We need first to have the One Health as the foundation and the principle for the whole instrument, not just one word here and there or one of the principles, but it should be the principle, the foundation of the work. Because we cannot prevent, we cannot prepare or respond or recover from pandemic if we don't work together. So this should be the guiding principle for us. And second, we talk about prevention. Prevention has little focus in the current draft. So we talked about what does it mean to prevent? Is it just vaccine for people after the event? Or we have to look at the driver, understand them, why we have those outbreaks and pandemic, how we can reduce the risk, prevent the spillover from animals to the humans, and what kind of hotspots or places or activities that can, if we work together on these, we can reduce the risk. So this is just a brief about the pandemic.
So move the prevention upstream, so to speak,
exactly,
as far as possible. I have a follow-up question, and since it's just the two of us here in the room, what was the reaction? What was the uptake?
I think it was very positive. A lot of member countries supported this because they understand that health is not just about not being sick. It's about the social determinants, the environmental determinants, the economic determinants. And if we don't work together to address these determinants, we will keep in the same cycle of panic and then neglect and so forth. So we see a lot of support, and I just want to add one information about the One Health group of friends. That consists of member countries advocating for One Health in the pandemic instrument.
Okay, so, and who's ever interested can approach you with the drinks later to get more information. Francesco, please.
Yeah, I'd like to try and answer the questions on the action plans. Also because, the way we work in the Secretariat, we are holding the pens on the files, each one every year. So this year is WHO, so it's actually us who are making the first move. Hopefully the others will like what we're doing. But the idea is that we're developing a framework. So we're not asking countries necessarily to develop new plans, but it's basically indicating what elements really need to be there in whatever plan is existing, whatever mechanism the countries will decide to use to incorporate this element. So this is about really an approach. It's about the lens. It will indicate which policy areas are relevant. It will perhaps refer to some concrete experiences. We'll talk about institutional mechanisms to collaborate, but this will be elements that each country will be able to interpret the way they want. So if you want to develop new plans, up to you, but clearly developing plans is an intensive exercise, so probably building on the existing would be the best approach.
I think Wendy was first, and then I'll...
Okay. Building on the existing, the gentle lady from Flanders, within the European environment and health process, there's something called national portfolios of action for environment and health that includes climate change, biodiversity, air pollution, water sanitation. It goes on and on and on. And I think it's a good opportunity that we could actually apply a One Health approach to that national portfolios of action. So that is one. So we are not inventing something new, but we could use One Health approach in terms of tackling that. And the second one, if I may, on the pandemic treaty, well, we are not negotiating it. Governments are negotiating that. However, the few suggestions we have given in the context of principles is, for example, did you know for the first time we have recognized now the right to a clean, healthy, sustainable environment as a human right. So we want that to be one of the principles to recognize the right to a healthy environment. Second, if I may, in terms, and then I'll stop talking. In terms of prevention, just like the medical team loves to talk about primary health care, one of the things we really need to look at is how can we also do prevention at source. We need primary prevention at source. And I think that is really important, in particular in the context of climate change, biodiversity loss, and pollution, which has a significant impact on the topic that we are discussing here. Over to you.
Thank you. Just before I hand over to you, I just want to stress that because I think obviously most of you know this, but whoever's online or here and wants to influence the pandemic instrument, it's actually not you who are doing it, as you said, but the national government. So go lobby them if you have any specific issues. But please, Keith.
Yes, I just wanted to respond. There was a question, I think, about sort of where do particular emphases on, for example, neglected tropical diseases, where do they fit in? Well, I think a lot of people they look at a new initiative and they get a little bit worried because they don't see a name or something that they really passionately care about. So this does not replace those existing roadmaps agreed by any of our organizations as being priorities. In fact, it says, let's support them and achieve them to be successful. So that's true for AMR, it's true for the neglected tropical diseases. But more than that, we know that there are hugely passionate, experienced people who've been really helping to deliver the type of One Health changes to achieve some of those progress against neglected tropical diseases. And we need your experience. We need your understanding of what you have to do at community level to achieve success. So beyond us, there's a huge number of people we know out there who have a community, essentially, of people who are practicing One Health in their way. So one of our tasks is how do we utilize all that experience? How do we share it well between countries which are going through change? How do we ensure that what's known by the civil society organizations and so on in their work is well captured and they can contribute? So we will not achieve change just as four organizations. It has to be a whole of society, but aided by a whole community that learns from each other. Thank you.
Thank you, Keith. Go ahead, please. Thomas, and then we'll have a last round. Exactly, didn't forget you, sir.
I don't want to sound boring, but I mean, most of the issues that we just discussed are incorporated in the One Health definition that we have from OLEP. So basically taking this as the basis for, the pandemic instrument, I think will cover most of the topics that we discussed. Now, I mean, for me, the surprising point was at first that it wasn't heeded so far. And the second positive one, that actually I think we got the message across, or my colleagues and you got the message across at the meeting last week, that it actually has to be the foundation for everything. Coming back to the discussion on prevention, again, this was also a request by the partners towards OLAP now to work on a definition for prevention. Now, we don't want to concentrate solely on working on definitions, but I think, I mean, first of all, having seen the success of the definition for One Health, and second, that I see there is an absolute need for a definition of prevention as well. We have taken this already on board, and without foregoing any result, I mean, the first discussions within OLAP have already shown that, I mean, OLAP means, if we call something prevention, it is prevention at the source. Yep. I mean, if we don't succeed at that level to reduce the risk, we will never eliminate it, but reduce the risk. I mean, we will fail in all subsequent areas as well. And I mean, a good example is COVID-19. And now, I mean, ask yourself, when do you think there was a reasonable point in time that this pandemic could actually have been stopped? Ask yourself, and we can discuss over a beer later in front of T-Rex. Thank you.
Excellent. So what keeps us from the beer are three things. I want to have one last round of questions from the floor, and maybe one question from Anja from online, and give you a last final question, and then we have closing remarks as well. So please, yes, Isabel, nee, zu deiner Rechten, genau.
Thank you. I'm Papa Sek from Senegal. I'm the Senior Technical Advisor to the President of Senegal in charge of animal health, fisheries, and global health security. So it's my pleasure to be here. And I should really thank Catherine Mashalaba for inviting me in this very interesting meeting. I like to talk about One Health because myself, I started working on One Health since 2007. In that time, I was in OIE, and I can assume here that these institutional bodies work on One Health since a while. But now, for me, the issue is how to really put in practice what we are doing globally on the ground, I mean, in the countries, to be able to really implement the One Health concept. And I really like Professor who said that One Health is a way of living. Yes, it is a way of living that who demand a change of behavior from all actors. I mean, health actors, but also non-health actors. And for me, a way of living, if you want to sustain it, you need to have some rules. Some rules. And I would like to ask you here, you from the Quadripartite, are you ready to raise the One Health to the level of standards, the level of regulation, to be focused, put the One Health in the international health regulation? So, for example, if a country wants to do its GE, Joint External Evaluation, he should see the One Health among the criteria it has to rate to be able to have a good note for his GE. So I would like to be focused, say, are you ready, guys, to put the One Health has a regulation so country to be able to enforce it within countries?
Thank you.
Thank you so much.
Thank you. Thank you very much. And I had one more show of hands, two. One there, and then we have a look at online. Yep. Make it brief, because you're standing with your question between us and the food that we can smell.
Oh, yes, okay.
Thank you very much. My name is Anna von Rönne. I'm managing editor of Healthy Developments. I'm going to be devil's advocate a little bit. What I would like to know from you is, I'm wondering the whole time, I'm also connecting to what you said, that actually One Health is a way of life or a way of thinking. And you've been talking a lot about additional budgets and funds that you need to now actually implement this. And I'm wondering the whole time, actually, you know, you are 4 UN organizations that have budgets. I can think of 3 ministries, probably more in countries which have budgets. And from what you're saying, actually these ministries and these UN organizations should be doing things they are doing now differently. So why not, you know, can you give us examples where you're using money that you're using now for tasks and you start doing these things differently? You know, I can understand that you may need a little bit of extra money, but how about, I think the real work is done when you change doing things the way you do them now and do them differently. I think that's somehow much more important, and you know, maybe you don't need so much extra money for that.
Thank you. Yes. If you can pass the microphone to the lady with the red mask.
And hi, can you hear me?
Yes.
Good. The feedback, sorry. So my name is Anna. I'm from the International Federation of Library Associations and Institutions, Science and Technology Library Section. It's the whole name. Yes, and I'm also a science communicator, but anyway, so my question is going to sound like a rapid left turn. So since the library community is already very much involved in access to information, access to learning and education, open science, and public participation and engagement, I wonder if it is in your plan to involve the library community to achieve the objectives of One Health. So.
Which community? I wasn't sure.
Local community.
The local?
No, the library community.
Library. Okay,
yes.
Thank you.
Yeah.
That's an interesting question to bring in here. So, Anya, do you have one short question you want to bring in here from online chat?
Yes, there is a question about if there is a common denominator or marker for monitoring the progress and compliance with the One Health approach across member countries.
Okay. So without opening a whole new discussion, can I offer you the reaction to answer any of these questions or to react? Francesco, please.
Yeah, I would like to take the question on the regulations. You've heard, I mean, this is about multiple actions. So a regulation is clearly one of them. And I'd like to give the example of traditional food markets, for which actually there is a document that 3 of our organizations have supported that is calling for a ban of the sale of live wild animals in traditional food markets. And you know, ban is basically a regulation. But you know, we understand that that regulation is probably not enough. I mean, first of all, it needs to be put in place. Very few countries have that regulation. Those regulations sometimes need to be done not only at national level, but they need to be done at municipality, at local level. And then there's a problem of enforcement of the regulation. You can't have a regulation without a system to enforce it. And then this establishment of regulation is actually creating a series of consequences that need to be addressed. You know, for example, with the design of markets, which is an infrastructure problem, or the livelihood of workers, which is a social problem and you know, a labor problem. So, I mean, just you know, to give you an example, to say that yes, of course, regulation is needed, but unless there is a full understanding of the challenges, and you know, that's why risk analysis is important, and a full understanding of the implications that need to be taken by different sectors and through different avenues for the solution. So, I mean, it's not only about, you know, we have a regulation and that's it. It's about the whole system that needs to be changed in order for that particular risk to be minimized.
Thank you.
Yeah, I'll try to tackle two of the questions. So I think one of them from the Library Association. I think that it's a little bit like I was saying earlier. We recognize that real change will be achieved by mobilizing not only the experts we have at the moment, but actually the next generations of ones who are influencing or practicing One Health in their work in these different sectors. So ensuring that there's a way that people can access guidance, contribute to guidance, have a process of expertise being available. That's part of our longer term development. We didn't talk about it so much here. We've established the One Health high-level expert panel, but there are thousands of people that want to be involved in some way. So the way of ensuring that there is access to that, but also it's a two-way development of new knowledge and information and making sure it's available. So that could be an interesting thing we discuss.
Just a short follow-up. What should Anna tell her colleagues, who to call or who to write an email to get involved?
Well, we're not separating what we do, so we do have actually a quadripartite secretariat that actually deals with these. So don't divide us. Please go
but the secretariat is a
yeah.
good email.
And the second one was a question really about sort of using our existing resources in a better way. And I think that's where Wande was saying, we have UN country teams. Now the better way, because WOAH doesn't have country teams, is that as one, we are here to influence those country teams, including the parts which our colleagues here, where they don't have country teams. So some of our organizations are involved, FAO and WHO in particular at country level. That shouldn't matter. We've got country teams that might be able to put these things on. So that's a way of efficiency. We're not all saying we want 4 offices in each country to deliver this. We're actually saying, no, we want to work in a new way and influence and use the channels that we have to put things on the agenda to make an influence. And that's the kind of the key point on that.
Thank you, Chalia.
Just to complement on this, it's not just our agencies and our offices. We have a wealth of network of collaborating centers and reference labs that are national or subnational that are supporting our work. So we have to leverage all these existing mechanisms and access to knowledge and data to be able to achieve our goal. Thank you.
I'll be quick on regulations. We talked about a little bit on the pathways is actually one of the things we want to do is policy regulation. For example, we have something called CITES, which is looking at the trade in endangered species. How is that enforced at the country level? So that needs to be enforced 100%. In terms of financing, I don't want to go into new additional fundings and so on. For example, the little we have in terms of the Nature for Health initiative is exactly to build capacities at the country level in terms of One Health. But also there was something very famous called, maybe this is not the place to discuss it, but it's equally important, is the so-called the Addis Ababa Action Agenda, which is really about how do we mobilize resources, not only from outside, but also using what we have domestically more effectively. So part of what the UN country team is doing is also how do we make sure that our investments are actually put in the right place. Sometimes we have a tendency of investing in dead sectors. They will not generate revenue, they will not employ people, or they just harm the environment only. So how do we redirect investment into productive sectors? That could also be one area where we should, I know that it's not a One Health straight issue, but this is something also we need to look at in terms of domestic resource mobilization within, for example, within the UN country teams. Yeah.
Thank you.
Yeah, thank you. Two points. First of all, also concerning the library, I think it's essential that we, bring One Health and One Health issues into formal education. We have to bring it to schools, we have to bring it to universities, we have to bring it into curricula. And the earlier, the next generation or even the generation after hears about One Health, the closer we are to the goal to really implementing One Health in all policies, because actually One Health has to be a thinking by default. I mean, we are still trying to, come more or less from outside and say, don't forget One Health. It should be really by default. And I mean, this is at least the goal that we should set ourselves for the next 10 or 15 years, also in this joint plan of action.
Charles Michel said today it's a sine qua non in closing the WHS just a few hours ago. So that comes quite close to your default.
Definitely. And the second point is, in the last 2 years, I learned one new word, and this is de-siloing. I don't even know whether there's a German translation of that, desiloisieren, and it sounds awful. But de-siloing is actually, that's what we are all working on. And breaking the silos is actually, it's not easy. It's not trivial. The fact that we are here, the Quadripartite plus OLEP is just one step in that direction, and actually talking about resources and not reinventing the wheel. Indeed, all the different partner organizations, they have their networks. They already have capacities on the ground. It's a matter of linking them efficiently together, not creating something new. This is something I think we all don't want to, but facilitating the interaction. And again, also it sounds boring, just remember the 4 C's in the definition. This should be the basis.
Thank you, Thomas. And when the discussion is best, my job is the hardest, because there is more room. I know, Chadir, you wanted to say something, but I would suggest we'll leave it at this and have, in a moment, you have a possibility to discuss further. For the time being, thank you very much to our panelists. Let's have a great...
Thanks to you. The facilitator. Thank you, Constance.
And now I would have liked to hand over, please have a seat. I would have liked to hand over in person to Cem Özdemir, but just this morning he informed us that he couldn't make it for personal reasons. He sent not only his regards, but also a very short closing remark that he pre-recorded. So let's give him that floor in a moment. He's obviously the federal minister. Sorry, I was...
Today's conference is a significant milestone in our joint path towards translating One Health from a scientific concept into practical guidance. This is exactly what the Global One Health Joint Plan for Action aims to do. It is evident that we need to consider the bigger picture in order to gain an integrated view of human, animal, and environmental health in theory and practice. Or to put it briefly, this is yet another challenge that requires us to think outside the box. In Germany, One Health has been well established in many areas and especially in professional circles for numerous years. In recent years, a large number of establishments and institutions that are committed to the One Health mentality have also emerged here in Germany, such as the Specialist Institute for International Animal Health, One Health, that is being developed at the Friedrich Loeffler Institute under Professor Mettenleiter's aegis. When the federal government was appointed last year, we agreed in our coalition agreement to reinforce the global health architecture within the scope of the One Health approach. More specifically, at the beginning of the month, we undertook in an interministerial research agreement to develop the already existing National Research Platform for Zoonosis into a research platform for One Health. This will enable us to act more quickly and effectively in detecting and managing research needs within the area of One Health. This will be an important contribution by Germany towards strengthening global health within the scope of the One Health approach. And of course, it will also be a key component of Germany's action plan. Ladies and gentlemen, One Health is the defining topic of our time, and it is good that you had an in-depth exchange today. Not least because every event that is held raises awareness for the subject. However, for One Health to become, as you once put it, Mr. Mettenleiter, a way to life, there is still a lot of work to do in this context, with regard to consumers, veterinarians and doctors, but also with regard to practitioners such as, for instance, farmers. But after today's event, I'm confident that we will be successful in further implementing the One Health Joint Plan to action. Thank you all. Good luck.
So thank you very much to the Federal Minister who couldn't be here but sent us his regards. And he said there's a lot to do still. I think we've heard, and I, from my side, can say I understand now better how the Joint Plan of Action is an excellent platform to build on it, to build on top of it, so to speak, jointly, robustly, and convergently, if I can say that, and really reap the co-benefits that should come out of it. That's the end of the discussion, and now the nicer part starts, the even nicer part. So please, there's some food here, and don't miss the opportunity to see Tristan Otto, an amazing skeleton just around the corner. We were given the specific permission to wander the museum at night by Professor Vogel. So have a great night. Thank you all for coming.